Good Thursday afternoon. I'm Dr. Martha Buchanan, Senior Director and Public Health Officer here at the Knox County Health Department. Our moment of gratitude today is dedicated to the students and faculty who have resumed classes at our local universities. We know this school year has already started out different than any other, but are grateful for the way in which you're contributing to our community in meaningful ways, while also practicing the 5 core actions to keep yourself and those around you safe. Our real-world example of putting the 5 core actions into play today is having someone over to your house to provide an essential service or function, such as an electrician or cable provider. First, when you're looking to hire a service provider, ask the company what their COVID protocols are. This will help ensure you have folks in your home who are looking out for the safety of you and your family members. When it comes time for the appointment, if you are ill or the service provider is ill, reschedule the appointment for a time when no one is ill. Ask the service provider to wear a mask before entering your home and during the entirety of their visit. If you make this known prior to their visit, the precedent is set, and it reduces some of the potential awkwardness of having to ask when they arrive. You and anyone else who is home at the time of the visit should also wear a mask while they are working in your home. You can consider having spare masks to offer folks if they forgot. Maintain a distance of at least 6 feet the whole time they are working. During indoor services, take a few steps to maximize ventilation, such as turning on the fan or AC or opening windows. After the provider leaves, clean and disinfect surfaces in your home that may have been touched. Those are just a few simple steps to help keep you and those around you safe while still going about your life. As mentioned last night during the Board of Health meeting, Chairman of the board, Dr. Gocher, and I were asked to attend the Joint Government Operations Committee meeting in Nashville next Wednesday, August 26th. While there will be no deliberation or voting on Board of Health matters, we wanted to make you aware of this meeting since there will be 2 Board of Health members gathering. The next Board of Health meeting will be on the same evening at 5 p.m. As a quick note, we want to encourage you to start planning a time to get your flu shot. While we do not have flu shots here at the health department yet, we are aware of some pharmacies in our area that do have the vaccine. It is always important to get your flu shot, but this year it's especially important. Next week, we will move our media briefings to 12:30 on Tuesdays and Thursdays. A reminder email from our JIC will come out later today. Now we'll move to the local situation. We have 127 new confirmed cases since yesterday's report, giving us 5,655 confirmed cases of COVID-19 in Knox County since March. Additionally, we have 203 probable cases. 3,599 of our cases have recovered, giving us 2,207 active cases. 239 individuals have been hospitalized at some point in their illness. 43 Knox County residents are currently hospitalized. We are grateful to report no additional deaths related to COVID-19 today, keeping our total at 52. Now we'll transition to the benchmarks, which are updated weekly on Wednesdays. As a reminder, for the majority of our benchmarks, what we want to see is no 3-day statistically significant shifts within a 2-week time period. Every day we look back at the previous 2 weeks. That's what a rolling average is. Overall, what we mean by this is are things getting better, staying the same, or getting worse? And if so, how much better or how much worse, and at what rate? We'll now pull up the data, and as a reminder, all of this data that we're going to talk about today is on our website at covid.knoxcountytn.gov/case count. Moving to the first benchmark, sustained reduction or stability in new cases for 14 days. To illustrate this benchmark, we have a bar graph that shows previous cases, new cases, and the growth rate over time. We did not see flags during this 14-day time period, which indicates a stable or decreasing trend. However, we are still seeing an average of around 88 cases a day. While we are still representing this benchmark as yellow, the lower volume of new cases over the past 14 days is encouraging. We hope to see the lower volume of new cases turn into a downward trend, but in order for this to happen, everyone needs to continue following the 5 core actions everywhere they go. Our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test result reporting turnaround time. For this benchmark, we utilize 2 bar graphs, one that shows a sample of the tests conducted for Knox County residents, and another for the average time between specimen collection and lab report. From the data, we can see the trends are heading in the right direction. The number of tests conducted continues to trend consistently, and the lab turnaround time in our community also remains consistent. The average turnaround time in our community is 2 days or less. This is encouraging and is why we are representing this benchmark as green. Our third benchmark, sustained or increased public health capability. For this benchmark, we aim to speak to cases within 24 hours and close contacts within 48 hours. To date, throughout this pandemic, we've accomplished that for all of our cases and contacts. Because of that, this benchmark continues to be represented as green. Our EPI support team remains consistent at 233 individuals and is well equipped to handle the current caseload. Should the local situation change, we will make adjustments to increase our capacity accordingly. Our fourth benchmark, healthcare system capabilities remain within current and forecasted surge capacity. These graphs show the availability of regional hospital beds, ICU beds, and ventilators in our hospitals from our hospital partners. It also shows the additional surge capacity for these categories, as well as the COVID positive patients and the patients with pending test results in the hospital. These data are gathered from the information hospitals put into the Tennessee Healthcare Resource Tracking System, or HERTS. It may reflect Knox County, the East Region, or patients from other jurisdictions. The traffic light is yellow. We did experience a day of statistically significant increases regarding positive patients, but there were no flags noted for ICU patients or ventilated patients. After speaking with our hospital partners, they stated their benchmark should be represented as yellow. The hospital systems continue to meet daily, assess the situation, and plan their response together. As always, decisions regarding how to classify this benchmark as green, yellow, or red are made in concert with our hospital partners, as well as taking all of the data into consideration. Our fifth benchmark, sustained or decreased COVID-19 related death rate for identified positive and probable cases. For this benchmark, we use a graph that shows the reported deaths of Knox County residents by date of death. This benchmark is represented as yellow. As a note, over the 14 days that this benchmark was measured, 11 deaths were reported compared to 17 reported in last week's benchmark. I'll now open it up for questions.
All right, as a reminder, go ahead and submit your questions into the chat feature, and please type in your name and the media outlet and which you're affiliated with. For the first question we have is from Megan with WVLT. Is there a plan in place for Knox County schools in the event of a new surge of COVID-19 cases?
The schools do have a plan, and details about that plan would best be asked to the schools.
From Claire with WUOT, she says this comes from a listener. The probable case number is quite large, and we don't have any accounting for what happens to those cases. When it comes to official tracking with the daily bar graphs, the probable cases are not shown. Why list probable cases if we're never going to know the outcome?
Okay, so the probable cases are all treated just like cases. They're in isolation for at least 10 days until their symptoms resolve. So a probable case is a case that's a close contact to a case that becomes symptomatic. And there are a couple other definitions. If a physician feels like somebody's symptomatic and they do an antigen test, that person would also be counted as a probable case. That number is in our total case count. That total number. So it's included in the total number, and it's also included in the recovery number. So that's why sometimes those numbers seem like they don't match, because our total case counts are cases plus probables. And the recovered number is also includes those recovered probable cases. So they're treated just like cases and accounted for in our system.
Also from Claire with WUOT, she says this one comes from a listener as well. UT has a notable increase in infections today compared to last week. Are those cases in the Knox County count?
If they're living here in Knox County, they are in the Knox County count. And so if they're on campus at UT, they're counted, or even if they're living off campus in Knox County, they're counted in our count.
From Grace with WBIR, case growth seems to be slowing down, but hospitalizations are trending up. Is there any explanation for that?
Right. So one of the things that we've talked about at the Board of Health with Dr. Shamia is the lag time between case counts and hospitalizations. So from the time somebody becomes ill with COVID-19 and then they get tested for COVID-19, and then they get sick enough to go to the hospital and then go to the hospital and then they have to be discharged from the hospital, there's some lag time there. So it's really about lag time. We expect that to catch up and see those trending down like our case counts are.
From Megan with WVLT, what steps should a family take after finding out one member of the household is positive for COVID-19?
It's a great question. So everybody in that household is considered a close contact, and they will be asked to quarantine. So that means they need to stay home for 14 days after their last contact with the case. So obviously, if you live in a household, that can vary. That could be after the person gets released from isolation, your 14 days starts then, or if the case is able to go somewhere in the house and totally isolate there and not interact with the rest of the family, then your quarantine can start at that point. Or if the case is able to actually leave and maybe stay in a hotel room and have no contact with the family, then the quarantine starts them. So they're all in quarantine. They'll be monitored like cases. So they'll be called on a daily basis to see how they're feeling, make sure they're staying in quarantine. If any of those close contacts in the household turn into case or probable cases, they become symptomatic, they're then considered a probable case. So they move over into the probable case count. And one thing to remember about quarantine is you can't test yourself out of quarantine. And quarantine means staying home. You don't go to church, you don't go to work, you don't go to school, staying home. When you do go out to get groceries or things like that, if somebody has to do that, then they need to wear a mask and keep it on the whole time just to protect other people. Because we know people are contagious with COVID a couple of days before they start feeling badly. So you could be contagious with COVID and not know it. So that's why, again, it's really important to practice the 5 core actions all the time. But the other thing for the family to know is they're going to be called by us. And they might also get some calls from the Tennessee Department of Health. They're helping us do some monitoring. So after we do the initial case investigation, Tennessee Department of Health will be calling it on a daily basis. And one thing we ask is that people understand that the questionnaire is long. And some of the folks we're bringing on, this is a new process for them. They're learning. They have a lot of support from my staff who've been doing this for a long time and do it daily throughout the year. But have some patience. We'll have patience with you. Have some patience with us as well.
From Grace with WBIR, she said they have a few viewer questions as well. The first is, what is the breakdown of the severity of each positive case of COVID-19? And how does age play a factor into the severity of COVID-19? So
it's been well publicized that older individuals do frequently have more complications and tend to have a more severe disease. So they tend to have more complications. So that's how that's well documented across the country and other places. And when we look at the severity of disease, it's spread out across all ages. We have 22-year-olds who end up having to go to the hospital because they get sick enough to need to go to the hospital. One of the things that plays a role in that is whether somebody has a chronic illness. And we're learning more about chronic illness and how it impacts COVID disease as we go. And I think they've even added to the list of chronic illnesses that are considered to make somebody high risk for complications of COVID. So that varies based on the health of the individual and their age, and all of those things impact how sick somebody gets with COVID. But even healthy people can become very ill from COVID and require hospitalization. So I don't want anybody out there to think that Only people who have chronic illness or older people are going to become very ill from COVID. Certainly healthy people can become very ill with COVID. So again, really important for all of us to protect each other and practice the 5 core actions.
Also from Grace with WBIR, in regards to the death toll of COVID-19, out of the deaths reported, how many actually died because of what the COVID-19 virus did to their body?
So the deaths are reported from the Tennessee Department of Health, from the medical examiner's office, and from the Tennessee medical examiner's office as well, and hospitals. So the doctors who are seeing the patients are determining what's the cause of death. So we're reporting that information out. We do not have the details of those cases, but that's being determined by medical professionals before we get that information.
From Austin with WATE, what was the contact between the health department and the school system regarding the Bearden football team, and was there a delay in letting parents know about exposure?
As you know, we don't speak specifically about any situations. We speak with the schools on a very regular basis. I think right now we speak with somebody at the schools almost every day. Somebody on my staff does that. So our teams are working very closely together. Leadership is having weekly phone calls, the health department leadership and school leadership. So we're working very closely together with the schools to make things happen as quickly as possible, honestly, as quickly as possible.
From Vincent with the Sentinel, last night members of the Board of Health and Dr. Buchanan said that they thought that public health measures and orders were working as hoped, but that these measures would need to remain in place for the foreseeable future. Could you speak to that?
Sure. So yes, we do believe that the mask mandates and other things are helping to bring our numbers down. And also the emphasis on the 5 core actions that everybody needs to practice. Those are really important. Those are the things that are going to help keep our numbers down and bring them down. When people get lax and they don't follow those, that's when we see an increase in our cases. So just like anything else we put in place to reduce risk, we can't just take it away because the risk is still there. The risk of COVID-19 still exists. So we have to keep the 5 core actions in place, the mask mandate in place. It's working. COVID is still here, and we need to keep those things in place in order to keep those numbers lower.
From Megan with WVLT, the Tennessee Department of Health announced that no information about clusters or cases at individual schools would be released. Is there anything parents can do to find out more about the COVID-19 situation at their child's school? I'm honestly not aware of what Tennessee Department of Health announced, but if you have questions about what schools are going to be sharing, those questions really need to be directed at the schools. Any other questions? Please go ahead and submit them now. From Grace with WBIR, she says this comes from a viewer. Of the cases in Knox County where a person was asymptomatic, have we actually seen anyone else get sick as a result of being around that person?
I honestly don't have that data in my head. We can certainly see if we can get that data. Sometimes that information is hard to get. So I'll have to look and see if we have asymptomatic cases that then created cases.
Claire with WUOT, does the public have access to these weekly calls between KCS and KCHD leadership? Do you believe these meetings should be public?
These are operational meetings where we're talking, we're exchanging information and they go back, and the school board sets school policy. So that's where the public information occurs around school policy and school decision making. These are operational phone calls, conversations. And then they take that information and go back to Superintendent Thomas and the school board and set school policy. So no policies being set. Those things happen in a different area where the public does have access.
All right, Vincent says 1 second. So I think he is typing. In the meantime, is there any other questions? Please go ahead and type them in now. From Vincent with the Sentinel, with respect to those public health measures, the local school districts, counties, and municipalities are not all doing the same thing to prevent the spread of COVID-19. Viruses don't really care about jurisdiction. Do you hope for more collaboration on a regional level?
Certainly, it would be ideal if everybody was doing the same thing. I think a lot of people are getting the message that the 5 core actions are important and choosing to practice those on their own. And I applaud those folks who are doing that to help keep their community safe and our community safe. So, we do know that there are actually some counties surrounding Knox that do have a mask mandate in place. And so, we encourage anyone who's in our listening area who doesn't live in Knox County to practice the 5 core actions too.
From Grace with WBIR, do you have conversations with regional counterparts, and what do those discussions look like?
Well, we actually have 2 phone calls with the State Department of Health every week. And on that phone call, our regional counterparts are part of those conversations. It's troubleshooting, it's learning from each other. We had this problem, here's how we solved it, sharing data, sharing updates. That's how we can get a lot of information, because they talk to the state, talks to the CDC regularly. So that's how sometimes we get CDC updates or State Department of Health updates. And then when we have other issues, so as you can imagine, folks who work in Knox County live in other counties, and folks who work in other counties live in Knox County and that kind of stuff. So we end up sharing cases. It's something we do all the time outside COVID. We work outbreaks with the East Tennessee region on a regular basis. It's rare that we have an outbreak in Knox County that doesn't also involve some activity with somebody who lives in a county surrounding Knox.
All right, any other questions? Please go ahead and submit them now. All right, not seeing any other questions come in, so thank you all, and we will see you again next week. As a reminder, our briefings will be back to 12:30 next week, so we'll see you next on Tuesday at 12:30. Have a good rest of your day and a good and safe